Hi, everybody. Welcome to MedTerm, and this lecture is going to be on Chapter 6, which is the digestive system. So let me share my screen, and let's get on with this. Okay, the digestive system. We're going to start off by just naming the parts of the digestive system. So the digestive system consists of the entire digestive tract, which is also known as the alimentary canal. So what we've got here, and I'm going to make this a little bit bigger so that you can see it a little better. So what we've got here is the whole digestive tract starts at the mouth when you chew or masticate your food, and it goes down through the pharynx into the esophagus. The esophagus goes down to the lower esophageal sphincter, which leads to your stomach. Your stomach leads to your small intestines. Small intestines, you can remember DJ, ileum, the duodenum, the jejunum, and the ileum. It goes past the cecum and goes into the ascending, transverse, and descending colon. And there's a picture on the next slide, so it'll make it a little more easily understandable to see the picture of it. And then goes through the sigmoid colon, the rectum, your anus, and that's where the waste comes out. So there's a nice depiction of the entire digestive tract. And the accessory organs of the digestive tract include the liver, the pancreas, the gallbladder. They all serve a purpose to help with digestion and getting the nutrients that you need from the food that you eat. So this picture breaks down. In the mouth, there are certain enzymes that are released by your parotid glands, your submandibular gland, and your sublingual gland. They're all salivary glands. So the saliva that your mouth produces actually serves a purpose. It moistens the food, helps you chew it. And there are also enzymes that start the process of breaking down the food so that it's preparing it for absorption. Passes through the pharynx, goes down the esophagus, okay? And you'll see that's a little bolus of food. So in other words, I just chewed something, swallowed it, and it's on its way down, goes down the esophagus through the lower esophageal sphincter into the stomach. The stomach releases hydrochloric acid, which then breaks that food down even more into something called chyme, C-H-Y-M-E. It's almost like a puree or a baby food type consistency. Goes through the pyloric sphincter into the small intestines, about 20 feet of small intestines, the duodenum, the jejunum, and the ileum. Passes by the cecum, which is right by your appendix, which doesn't do anything, and then goes into the large intestine, also known as the colon, the ascending colon, transverse colon, descending colon, down to the rectum and the anus, okay? So these are all the parts of the alimentary canal. Your teeth also are part of the alimentary canal. There are the accessory organs, the liver, the gallbladder, pancreas. And so what happens in that alimentary canal is the physical and chemical breakdown of the food that you eat so that it's preparing it to be absorbed by your body. And then anything that's not needed, which is waste, is eliminated. Okay? So I want you to list the combining forms for the esophagus, salivary glands, the pharynx, the stomach, and the pancreas. So I'm going to take a quick minute of a break. And hopefully you got this correct. The esophagus, esophago, the salivary glands, cialo, pharyngeo, gastro is the stomach, and pancreato is the pancreas. So I will actually put those here. Esophago, salivary glands is cialo. The pharynx is pharyngeo. The stomach is gastro. And the pancreas is pancreato. There you go. And next, we have the rest of the organs. We have the spleen. That would be spleno or spleno. The tongue, glosso, or it can also be called linguo. That's pronounced linguo. The liver is hepato. The ileum is ilio. And the gallbladder, and this one is a little difficult for some people to remember, cholecysto. Okay. We have the rectum, which is recto. We have the anus, which is ano. The anus and the rectum together are procto, like a proctologist. The duodenum, duodeno. And the colon is colo. Don't confuse it with YOLO. Or it can also be colono, like colonoscopy. The sigmoid colon, that one's pretty easy. Sigmoid O. The mouth, oro, like oral. Or you can also call it stomato. If you have inflammation of the mouth, that's stomatitis. The gums are gingivo. The bile that's stored in the gallbladder or referring to the gallbladder is chole, and the bile duct is choledocho. Okay, make sure you know these combining forms for these words. Okay, when we talk about a discharge or flow through something, dia. If you said Rhea, you got that correct. Without an appetite, and meaning without appetite, and orexia means without appetite. And swallowing or eating that is painful, anything that's painful or doesn't work properly, dysphagia. After a meal, that is postprandial. The doctor may ask you for a postprandial blood sugar. Something that's pertaining to under or below the tongue, sublingual. And a visual examination in an organ is endoscopy, okay, meaning within, right? Vomiting blood. So vomit is emesis, hematemesis, right, is vomiting blood. Tumor of the pancreas, pancreatoma, being a new growth. And then an instrument for examining the stomach would be a gastroscope. Okay. Enlargement of the liver. So we know liver is hepato, okay? And then enlargement is megaly, so hepatomegaly. A disease of the intestine, and usually we're talking about the small intestine, entro, and then when something is wrong, disease, pathy or pathos, right? Entropathy. And then inflammation of the gums is the heartbreak of gingivitis, inflammation of. So appendicitis is inflammation of the appendix. And it can come from a lot of reasons, sometimes an obstruction or an infection because a little piece of stool or some kind of foreign body or bacteria managed to work its way in. So appendicitis, signs and symptoms, very specific. The right lower quadrant of the abdomen is called McBurney's point, kind of halfway between the umbilicus and the right iliac crest. And it's weird because the people that have appendicitis will get rebound pain. So in other words, when you push on it, palpate, it does not hurt. When you release the pressure, that's when they feel the pain. If they get a sudden relief of the pain, that's bad because that can be a rupture of the appendix, which can be fatal. Accompanying appendicitis, they usually have fever, malaise, they just feel lousy, diarrhea or constipation, and then tachycardia. Tachycardia is one of the later symptoms. If the heart rate starts to increase like that, that can be a very bad sign. And the treatment is get it out, appendectomy, right? They want to get it out as soon as possible. You don't want the appendix to rupture. Like I said, that can be a fatal event. So some little case studies. Mr. Q presents to the ED, emergency department, with right lower quad pain, a rigid abdomen with increased tenderness and abdominal cramping. The physician confirms inflammation of the appendix. So his diagnosis is, you guessed it, appendicitis. Okay. Mr. R, a smoker and heavy drinker, complains of dysphagia for the past 4 months. After various tests, he is diagnosed with cancer of the, and we're talking about the esophagus, duodenum, and stomach. And it's usually the esophagus. The abbreviation RLQ indicates the patient's pain is located where? In the right lower quad. The physician informs Ms. J that her appendicitis may be the result of an obstruction or infection caused by a hard mass of fecal matter meaning stool. This type of mass is diagnosed as fecalith. Then we have diverticulitis, which is an acute inflammation of diverticuli. A diverticulum is a little pouch that can occur in the intestine, usually in the colon, right? The large intestine. And these little pouches can actually get pieces of food like seeds or nuts, berries stuck in them and become inflamed. And then it becomes diverticulitis. Diverticulosis means they have diverticuli, but they're not inflamed. Okay, so one is a diverticulum. Many of them are diverticuli. Diverticulosis is having diverticuli, and inflammation of the diverticuli is diverticulitis. Say all that 3 times fast. And signs and symptoms, it depends, you know, usually bowel changes, they'll have like an irritable bowel, constipation, diarrhea intermittently, tenderness, pain in the left lower quad usually. Sometimes they can get bleeding. This is when the condition gets undiagnosed. They can get weakness, fever, fatigue, and anemia because they're losing blood, and it can even rupture. So if the bowel ruptures, peritonitis can occur because all of that fecal matter that's supposed to be in the bowel can leak into the peritoneal cavity. That's bad. It's basically toxic waste. And the treatment would be clearing up the inflammation and infection, resting the colon. So usually there'll be NPO, no food or drink, IV antibiotics, IV fluids. If it's really bad, they may need surgery. So Ms. O's radiograph shows pouch-like herniations throughout the muscular layer of her colon. These small blister-like pockets are diagnosed as, they are diverticuli. The nurse charts Mr. J's complaint of extreme constipation as, is it diarrhea, obstipation, or colopathy? Well, if you guessed obstipation, you were right. And Mr. F is diagnosed with a severe case of diverticulitis. His symptoms include left lower quad tenderness and pain. LLQ means that the pain is located in the left lower quad of the abdomen. Cholelithiasis and choledocholithiasis, the formation or the presence of stones, gallstones, either in the gallbladder or in one of the bile ducts. So stones can occur for lots of reasons. The gallbladder is kind of a storage facility, and it concentrates and stores bile so that when you eat fatty food, it can release the bile through the duct into the intestine so that the bile can help to metabolize and absorb the fats, the lipids. If the person does get stones, sometimes they're asymptomatic. Sometimes they get something called biliary colic, which means that that bile duct is obstructed. So they'll get this acute onset of this upper right quadrant pain, and it can sometimes radiate up to the shoulder and the back, sometimes nausea and vomiting. And usually it's after McDonald's or any large fatty meal. I'm not hating on McDonald's. Non-surgical treatment, if they're asymptomatic and there's a history of gallstones, unless the symptoms appear with complications, we may not do anything. We may do what's called extracorporeal shock wave lithotripsy. That's a mouthful, where we kind of pulverize the stones to open up that bile duct. And sometimes we can do bile acid therapy, which helps to dissolve stones that are made mostly from cholesterol. Surgical treatment, laparoscopic cholecystectomy. Basically, we go in with a scope and 3 or 4 incisions, little puncture holes, and remove the gallbladder. It's minimally invasive. We can do an open chole or a choledocholithotomy, which is an incision in the duct to actually remove the stone without removing the gallbladder. Ms. G presents with an acute onset of upper right quad abdominal pain that radiates to the shoulder and back, and she complains of nausea and vomit. The physician suspects gallstone formation in the gallbladder and orders several diagnostic tests to confirm his evaluation. The tests confirm a diagnosis of, you said cholecystolithiasis, you are correct. So that's stones that are in the duct and the gallbladder. The physician explains removal of the gallbladder is the treatment of choice for symptomatic cholelithiasis. The procedure for excision of the gallbladder is a cholecystectomy. Mr. F is scheduled for ultrasound treatment to pulverize his gallstones. This non-surgical procedure, abbreviated ESWL, is called extracorporeal shock wave lithotripsy. And they use that for kidney stones also, just a fun fact. And then we have some other words here. We have the word anastomosis. And anastomosis is a joining together of 2 ducts or blood vessels or part of the intestines. Ascites is an accumulation of fluid in the peritoneal cavity. And borborygmus, and that's a fun word, is a sound that you can hear. It's an audible sound that's passing gas through liquid contents of the intestine. So it's the sound of, it's almost like a bubbling sound. Sound of passing gas through the liquid that's in your intestines, within intestines. Okay. Cachexia. If you say someone is cachectic, that means that they are wasting away, right? They're in ill health. They're skeleton-like. Dysentery is a disease that causes diarrhea with blood and mucus. Sounds fun. You don't see it much anymore, and it's usually because of inflammation somewhere. And a volvulus, there are certain dogs that are prone to volvulus, is where the bowel twists onto itself and it becomes obstructed, so it obstructs itself. Bariatric surgery, those are weight loss procedures. So there are lots of different types that can be done, and usually they're done with somebody who has morbid obesity, so someone who's extremely overweight. And what they do is they change the size of the stomach, basically. Lap band procedures, gastric bypasses. We have colostomies, where we go in and remove or excise a part of the colon that's diseased, or there's a tumor or cancer, and we create a new opening through the abdominal wall where the stool or feces is diverted into a bag. And they can be permanent, they can be temporary, and they're usually treatment for cancer, most commonly, sometimes for severe diverticulitis. A polypectomy is excision of small tumor-like growths, and they're usually benign, polyps, that actually project from the mucous membrane surface, usually in the large intestine or the colon. Miss K is diagnosed with colorectal cancer. CA is cancer. The surgeon will create an opening in the colon through the abdominal wall to the outside surface. This enables diversion of fecal matter into an attached pouch. The surgical procedure to create an opening, mouth, okay, of the colon is called a or an. If you said colostomy, you were right. And the physician discovers polyps during a colonoscopy. What procedure is he going to perform? A polypectomy to remove the polyps. The nurse explains surgical procedures are available to treat morbid obesity. The surgical procedure to treat it is called bariatric. Bariatric surgery. And the physician explains a surgical procedure where they staple the upper stomach near the esophagus to make it so tiny, like a little pouch. And then they put a band there. That's known as a vertical banded gastroplasty. Endoscopy, we talked about this before. An endoscope is we go into endo. It's a tube with a camera and it goes down into an organ. We can do a bronchoscope. We can go down into the lung. We can do an endoscope and go into the esophagus. Colonoscopy. It's a scope that goes into the colon, and that looks at the entire length of the colon, the ascending, transverse, and descending. If we're only looking at the lower third portion, that's called a sigmoidoscopy. It's a little less invasive. And then you've got barium enemas, barium swallows. Barium is a substance that illuminates when it gets into your body. So a barium enema, they would administer an enema of barium into the rectum and then x-ray the patient, and we would see that barium in the colon and find tumors or obstructions, right? Looking for cancer or other problems. Barium swallow is the same procedure, except instead of an enema, they actually have to drink the barium, and then we do an x-ray of the esophagus, the stomach, and the small intestine. And again, looking for tumors, any abnormalities, obstructions, etc. Ultrasonography, ultrasound, that's high frequency sound waves that go right to the soft tissue and put an image on a screen, like when you're pregnant, we do an ultrasound of the baby. A guaiac of the stool, which is also called a stool for occult blood, is a test that looks for hidden blood in feces. The word occult means hidden. And then a culture, any kind of a culture, is a test that actually identifies microorganisms or parasites, like different types of bacteria, etc., that are present in the feces. Or you can do a culture of stool, you can do a culture of urine, you can do a culture of blood. You're looking for something that's causing an infection. And then we have a few more of these. So visual examination of the sigmoid colon. Well, we know it's going to start sigmoid oscopy, right? An instrument for examining within the body, endoscope. And visual examination of the stomach, we know it's gastroscopy. Visual examination of the colon. These are pretty common. Colonoscopy. An instrument for examining the rectum and the sigmoid colon is called a this is a mouthful, sigmoidoscope. And the process of recording or x-raying a bile vessel is, remember, bile comes from that gallbladder. It's where it's stored. So it is cholangiography. Cholangiography. Then some of the meds that are used, there are antacids that they work just by neutralizing acid, like Tums or Rolaids. Antidiarrheals, like Imodium, which is the generic name is loperamide, can help stop diarrhea. Antiemetics, ondansetron, which is Zofran, is one of them, and that's for nausea and vomiting. And then laxatives. There are lots of different laxatives that can help you move your bowels if you're constipated. Milk of magnesia, for example. Mrs. J complains of nausea and vomiting for the past 3 days. Prescribed medication which controls nausea and vomiting by blocking nerve impulses to the vomiting center of the brain is called, if you guessed antiemetic, you were correct. Mrs. S is diagnosed with irritable bowel syndrome. The physician instructs her to increase her fluid intake and prescribes a drug that will control her loose bowel movements. This drug is known as antidiarrheal. If you guessed that, you were correct. And a patient diagnosed with excessive stomach acid is treated with, if you guessed antacid, you were correct. And that is the end of this chapter. So make sure you know the words that I went over in this chapter, okay? Understand the words and their meanings. And there were quite a few of them. I will stop the share and I'm going to stop the recording.